Acepsis, an ounce of prevention. Working in collaboration with Dr. Scott Earnest, DVM, and a dairy calf consultant with ProAGtive Dairy Nutrition. Exceptional calf performance starts with the birthing process, as detailed in Video 1, and is then followed by quality care of the newborn calf. Cows should be moved into maternity pens as soon as possible after calving, to maintain cleanliness, which is usually 1 day or less. Any feces, the placental remains, and the bedding materials should be removed, and the floor area must be disinfected. HabiShield powder helps here, with the removal of moisture and disease-causing pathogens. Managing colostrum is a critical component in a new calf program. Disease prevention and treatment can be significantly minimized when colostrum management protocols are established. A calf's primary line of defense is the immunity it receives from a sufficient amount of high-quality colostrum. This high-quality colostrum should be creamy in color and texture. It can be tested using a Brix refractometer. A value higher than 22 indicates high-quality colostrum. A pivotal factor to note is this colostrum should be free of bacteria, manure, urine and blood. Calves should receive 4 quarts of clean, high-quality colostrum within the first 2 hours of birth. This should be followed by an additional 2 quarts every 6 to 12 hours. Colostrum should be fed using a cleaned and sanitized nipple. In addition to the Brix refractometer, the bacteria levels in colostrum can be tested in a lab that offers bacterial culture. Although high-quality colostrum is thick and creamy, sight alone does not reliably predict the nutritional value, immunoglobulin content, or bacteria populations. Bloody or mastitic colostrum should be discarded since it has a higher risk of containing endotoxins and very high bacteria counts. Within 6 hours, the average ability of a calf's gut walls to absorb immunoglobulins decreases by 1/3. By 24 hours, the walls absorb less than 10% of what could be originally absorbed. For this reason, the following steps and protocols need to be maintained. All feeding equipment associated with the feeding calves must be cleaned and sanitized between feedings. Acepsis provides a full approach to improved feeding equipment hygiene. This information is also available in our CalfBiosecurity booklet, which can be found on our website library. Separate the calf from the cow. It is recommended that a calf be separated from its mother within 1 hour of calving. Reasons for early removal include ensuring adequate intake of colostrum, reducing exposure to disease pathogens, and reducing the stress on the cow and calf. Third, keep dry. A wet calf is a chilly calf, and keeping them dry is essential for keeping them warm. Extra care can be taken to wipe the calf dry with clean towels, using them with HabiShield powder. The use of HabiShield powder will allow quick drying of the calf and will reduce disease-causing pathogens. Keep warm. Calves are highly susceptible to chills and hypothermia, especially right after birth. A deep layer of bedding in the barn or calving box will help, along with a warming box, if necessary. Keep clean. Since these newborn calves have very little resistance to infections, they are susceptible also to bacteria and parasites. Once again, replace the bedding as often as possible to keep it clean and dry. The use of HabiShield is invaluable for reducing the moisture in the calf pen or hutch. For more information on calf biosecurity and well-being, check out the rest of the video series on YouTube, or contact us at info@acepsis.com, or visit us at www.acepsis.com. Acepsis, an ounce of prevention.